Now, we are going to see how do we vaccinate Maleks at day 1. 1 day old, it is just injectable. The administration is injectable at the neck here. Before, we were injecting at the thigh. But we discovered that if this syringe pierces that tiny bone of that cheek, it will become lame. But through the research, I advised whoever is engaged in chicken to start vaccinating at the neck. In a human being, that's BCG, which is vaccinated at day 1 against TB. But for Maleks, I mean for chicken, it is Maleks. I remind you that Maleks is a combination of various viruses. As that one, who discovered, or who manufactured, or who made HIV/AIDS? HIV/AIDS is a combination of viruses, of typhoid, of STDs, of TB, all the diseases you know, measles, all these viruses were combined and they made HIV/AIDS. I told you I'm a deserted medical clinical officer and I don't regret. By the way, whoever is viewing, let's go back. If you have ever viewed the film of Venom, this is what they were trying to expose. Venom. They were announcing that anytime, any day, expect that virus to break off. That's why we discovered from COVID-19 Venom film. It was an exposure or eye-opening that there is a disease which will escape from the lab. It escaped from the lab. So they were telling us about COVID-19. Now you can open your eyes. Because here, if it comes to be understanding and learning, this is where you need to get knowledge and skill. With me, Yisa Luigale Bachibinga. Now, for Maleks as a disease, if you don't vaccinate them at day 1, they should not exceed 10 days. If you don't vaccinate them at day 1, make sure 10 days don't elapse without vaccinating Maleks using the chemical medicine. But for we as living agriculture, even at 1 month, you can vaccinate because we have no complications. We have no conditions, and our medicine does not require refrigeration, neither ice. Can be kept anywhere you feel, provided that you don't put it in direct sunshine because it may burst due to the ingredients where we make this medicine. Our medicine is a dual purpose. Works as vaccines and works as medicines. Why? we need to minimize the costs of these medicines of our farmers, because you may have a farm of 100 chicks. You will realize and understand who living agriculture is. As I told you, we are not here just to entertain. We are here to train and share what you need to learn. Now, Ajat has 100 chicks of any breed. She happens to identify Newcastle in that very farm. Then, as it goes on, she identifies Gomboro, which we call as IBD. In the same farm, discover that there is avian flu. From that very farm, discover that there is coccidiosis. In the same farm, if you were to use the chemical medicine, Newcastle has no medical treatment. Get me right. If it comes to Gomboro, if you use an antibiotic, they are going all to die. You see where we are. But if you go to a pharmacy or a drug shop and you tell them that my chicks are sick, we will recommend you to buy tetracycline, 25%. And once you tell them that they have even a flu, they will advise you to buy doxin or erythromycin. As you go on telling them what is at the farm, that they have coccidiosis, the brown droppings, they will tell you amprolium. The same farm. And if it comes to fowlpox, you need Genta, 5%. Now, 100 chicks have all these medicines. How are you going to administer to this? 100 chicks. The 5 have shown in Newcastle symptom. The 5 have flu. The 20 have, in the house or in the litter, have the brown droppings. And some, they show the swelling of the eyes and the wounds on the head. I don't expect you to buy all these medicines. In the plants we have and our medicine we make, it is a dual purpose. It treats that medicine which is found in the chick. That's how we make it. Instead of buying gentamicin 5% for fowlpox, buying amprolium for coccidiosis, buying erythromycin for avian flu, which you call senyiga, or doxin, buying tetracycline 25% for typhoid. We use one for all. That's why we are called the ethno-veterinary agrovet. We don't deal in chemical medicine. However much that if somebody insists that wants to use the chemical medicine, we use it. But what we fear, if you treat these hens and they fail to cure, you are going to slaughter them and sell them off. Everyone who will eat those treated birds without waiting for 21 days, in 10 years, expect cancer disease. And we are not killers. We need to save the lives of the community. I thank you for viewing. I thank you for liking, sharing, and subscribing. It is Living Agriculture channel which came up with a solution of helping farmers to acquire knowledge by using your airtime and data. I have a friend, is called David, is in Nairobi here, sent me 100,000 Ugandan currency just for appreciating as Living Agriculture. Ndugu, I think if we could have people like you, our work will be going on very well. And some people asking, what if I send? Will you tell people? Yes, I have told you. It's called a worry. Sent me 100,000. 100,000 for appreciation. Namwe abalala muweereze. What I'm saying, even you who are viewing, I requested only $1. But even you can send even more than that. Why? Simply because we are trying to reach on the grassroots of the community, such that everything you need, because next time we are going to be in the forest or outside the room, such that every plant I talk about, I show it to you. Because these plants are around you, but you don't know them and you cannot use them. And yet, these are the ones which are made by the Bazungus and bring them back in formats of powder, in formats of liquid, in formats of capsules, and in format of tablets from plants. So please, this is where we are. Now, one day old chick, if it is ethanol, we called it universal farm care. Farm care ethanol veterinary agrovet. It is universal farm care ethno-veterinary agrovet. It combines all the types of medicines for various enterprises. We have that one of poultry. We have that one of piggery. We have that one of rabbits and livestock. For poultry, it is 30,000. But here the rest is 50,000. And if it requires delivery, you add the transportation fee to where you are. My people in Rwanda, my people in Zambia, my people in Tanzania, and my people in Malawi, my people in Kenya, they know that. Because being a global world or a global country, here, what we do, we have all the types of means by road. These ones, they reach at your destination. This is where we are. Now, if we are to be using our traditional medicine, one day old, it is just 4 drops in the mouth. This is the vaccination of Malex at day 1 or at the first 14 days. 4 drops in the mouth. We repeat this at 14 days. Day 1, it is the first dosage. At 14 days is the second dosage. And 28 days is the third administration. Completion of the vaccination. What am I trying to say? These diseases here, the administration, our medicine is not injectable. It is oral and external, just for spraying and smearing. Don't take our medicine and expect it to be injected. No.